everyone. Welcome back to another episode of ATtalks. I'm Tom, your host. We got the Georgia King, Mr. Hunter, and my man out in Las Vegas, Mark D'Anza. And hopefully Paul will join us. He's doing some yard work, but we're going to be talking about the athletic healthcare teams today. We're still doing the athletic training student guide. This is episode, I think, 9. So far, you got your job, you've done your negotiating, you're starting to build your relationships, you have your policies and procedures down, you're working on those, you're providing care, you're providing everything you can provide, and now you want to take it to the next level. You're looking at not just yourself, but the athletic healthcare team. So let's start with there. I'll even go first. I'm at Indiana, and my athletic healthcare team is me. It's the district nurse that works at the high school with me, our strength coaches, and my coaches, I put them in there, and then my athletic director, because she's in charge of everything. So we work together to provide the best care that we can for the students. And I'm still working on the team physician aspect because I just started with a new company in August and I have a new team physician. So we're still building those relationships as well and what that hospital brings to the team and to the services for my athletes.
Yeah. I actually remember when I started at Walton 4 years ago, you talk about team, I remember starting, we had just partnered with Northside Hospital and they were like, hey, here's, your doc, here's your team physician, got an orthopedic physician. And they was like, all right, there you go. And the first thing I said was, okay, I got a orthopedic physician who's overseeing our concussion cases. And I remember there was no answer at first. And again, we have grown from then, y'all, but I just remember there was no answer for that. A couple weeks later, they found a general med practitioner that was like, hey, this person can help out. But again, it wasn't a true partner. It was just somebody that found to kind of fill in the gap. And I actually remember probably a couple months down the line, for some reason that football season and so forth, we had a lot of concussions. And I just remember that physician reaching out and saying, hey, I've been happy to help you all, but the caseload that you're providing and the expectation to provide is a little bit too much for me. So halfway through the season, I lost that provider that was going to be able to provide the adequate care that we were looking for to oversee our concussion cases. So now I'm reaching back out to Northside. So what should I do? And it was just like, well, we're just going to have to kind of depend on your expertise and also your team orthopedic physician. So I just bring that up, it's been an ongoing process in regards to trying to help build that team. But that's where I started at Walton High School with just an orthopedic physician. But we have grown. We still have an orthopedic physician. I have to put in, my nurse, Sandra Evans. She has been a huge, huge advocate. We have grown our partnership in regards to what we need to communicate, how we need to communicate to oversee and make sure that we're overseeing the overall healthcare and wellness of our student athletes during school and also after school. Obviously, between Nurse Evans and also our team orthopedic physician, we do have a neuropsych physician who oversees our concussion cases, and he is amazing. He does a great job with his evaluation. His bedside manners is outstanding, and he educates the parents well, provides not just a return to play plan, but also provides a return to learn plan, which is very significant for our teachers because they have specific guidelines on how we need to continue to progress. So those right there, and then we partner with PT Solutions. So again, I have my team physician, we have a school nurse, we have a neuropsych physician, and we have our physical therapist that we connect with, and also occupational therapists within the clinic as well. So those are our probably day-to-day from a healthcare standpoint. I also add in just like Tom said, our athletic director is a part of that team. Obviously, the athletic director oversees athletics functions, so definitely needs to be a part of that team. I believe our coaches are full-time staff members of the school. They are the ones running their athletic programs and organizations. So they have they hold a stake in regards to decision-making, not from medical clearance, but a decision-making in regards to the athletes' participation. So they are a part of that. And then also we all know the parents are always a part of that. But in regards of our team, um, I named the main ones: orthopedic physician, neuropsych physician, PT, nurse Evans, and our athletic director. And we do also have, he's not full time, but through our booster clubs, Chris Romano is our strength conditioning coach that helps provide. So we have him a part of the team too in regards to educating and modifying activities when they're doing strength and conditioning sessions. So that's kind of where we are right now. Now we partner with Northside. And again, if I needed a podiatrist, if I needed a cardiologist, if I needed a specialist, like a hand specialist or something, I have a network, a contact of network that I can reach out to through my partnership with Northside, but they're not truly a part of my sports medicine team, if that makes sense. So we've definitely grown from just having that orthopedic physician to where we are now, but I don't have a orthodontist. I don't have a dentist. I don't have an optometrist. I don't have specific things that I think we should have that I'm working on.
I'm not practicing full time anymore. Now I'm teaching full time, trying to advocate full time too. That's sort of my role now. Thinking back to when I was practicing full time at Durango High School in Las Vegas, I worked with an outreach clinic. So I was with Select Physical Therapy, who employs mostly athletic trainers in Las Vegas, and they put us at the school and they sort of set up our relationships with our orthopedics. Like I said, I mean, orthopedics kind of like the standard for our field. Like, hey, everyone's kind of gotten an ortho, and then from there you sort of create those other relationships. The school nurse was a great relationship to have, just because I could always talk to them about the head injury stuff. The school nurses were vital with that. Where, hey, I let the nurse know, hey, this person's got a head injury, this person's going to be on crutches or a sling, just so they can help make accommodations for that student, so that they can get the stuff they need during the school day when I'm not on campus or not there and present. So that's probably one of the more important keys, especially with the secondary school athletic trainers, to make sure you get someone involved that's on campus during the daytime if you don't happen to be on campus during the daytime, because you need eyes and ears at both times. Select Physical Therapy actually started doing something really cool. They actually send PTs out to our campus for all our football games. Now they've been doing it for home football game, for special consults and everything like that. But that was kind of nice, just to sort of get people, hey, this is physical therapist. This is someone that is absolutely necessary with the process of taking care of the overall healthcare of the patient. Because I mean, we've talked about on this stuff many times, where we need to look at that care model and the overall health of the patient. If you're trying to do AT without the help of a PT, you're crazy, man. Like you need to have that relationship where I can say, hey, you're going to whoever our PT is at the clinic at that point in time. I can contact them, talk to them. They can tell me stuff that we can be doing here on our time, and stuff that you're doing in the office. They can talk to me about progress we're making and all of that. So those were always good relationships to help build, so that we can work better with the overall care of the patient. Like Tony said, I didn't necessarily, the people, all the administrators at the school, because I mean, that's sort of built into the EAP, who's kind of on the healthcare team, is we're like, okay, who's going to take care of certain things in certain situations? How are we going to get a hold of me? How do I get out to the field? How do I take care of things? Anyone that's in communication during an emergency situation is realistically part of the healthcare team. And I mean, heck, you can even put student athletes in on that. Like, they do have a role at times. That we've used student athletes to enact an EAP before at my school. Like, we had to do that, and it went smoothly because all the people that we were working with sort of knew what they were doing. But yeah, there was a ton of people. As Tony was going, I was like, who would I want what would I want as my ideal setup? Ortho, number one. It'd be nice to have a GP that's just sort of always not so much on call, but someone that you can be like, hey, I need this person to get seen for this general medical issue. Can you get them in really quickly? And that's one nice thing that our parent company set us up with. We had a lot of good relationships with physicians in town, where we just call up an office like, hey, can you get my kid in tomorrow? Okay, fantastic. And then we talk to the parent and talk to the school, like, hey, this kid's going to be going into the doctor here and there. And it was just basically through relationships. a dentist would be phenomenal. That was one thing I never had, and I never even really thought about putting the dentist in. But I mean, that's I have had a couple dental emergencies. I was just like, you got to go to your own person. I didn't have a specific person. We had a player once was at an away game and broke his face. Maxilla mandible just broken in a soccer game. And there happened to be an orthopedic surgeon on the sideline of the other team that actually took the kid in that night and worked on one of our kids. Like it just happened to be in that scenario. If we weren't in that scenario, that could have been a little bit more of a sticky situation. So just trying now, I'm just spitballing. So like, who else would you want for your ideal healthcare team? Like if you could have every ideal specialty out there.
Well, I think that go ahead. You guys can talk.
No, I was just agreeing that I would like to hear what everybody's ideal team would be. We kind of already described what was on our team, but would be ideal sports medicine team.
Well, my thought is on the side, guys. My thought is on the sidelines for a game. To be honest with you, ideally is an ER doctor. They deal with spleen injuries. They deal with fractured spines. They deal with those things that kind of above and beyond our scope of expertise. We know how to stabilize. We may know how to recognize, but they're not going to know how to deal with them.
Thank you.
Yeah. So Paul, we're talking about the athletic healthcare team.
Yeah.
So
I caught on.
what kind of healthcare team are you guys rocking out there up in the Northeast?
So I'm right outside of DC, so you can't throw a rock without hitting a doctor, to be honest with you. We actually have an orthopedic team physician and a family practice team physician. And the family practice that we work with has a sports medicine fellowship. So we get a fellow that comes over to every game, and they come to the athletic training room once a week because they're actually learning from us as much as we're learning from them and utilizing their skills. We also have a dentist that comes to our athletic training room twice a year, makes custom molds of our athletes. I get the molds and I make the custom mouthpieces. I've got the dentist on hand, and I've got their cell phone number. So if there's a dental emergency, we can call them and get them set up. We have a physical therapist in our area that we work with, and I have a chiropractor in our area that we work with who's a dual credential PT chiropractor. So
what's
we
the
don't
insurance situations where you guys are at? Like in Vegas, we have a ton of different insurances, and that complicates things a little bit with creating the healthcare team. What's your guys' insurance situations like with your student athletes?
We actually have quite a bit, and being right outside of DC and right outside of Bethesda, a lot of TRICARE, a lot of Kaiser, but most of our doctors, because of the area we're in, knowing how many insurance companies there are, take most of them except for Kaiser, and because Kaiser is such a strict HMO, you've got to be in their network. And then TRICARE is a little shaky. Like there's TRICARE, plain TRICARE, and that's a straight military. So they got to go to a military base or a military doctor. I think it's TRICARE Prime is more of a PPO. So they've got some advantages. They can go outside of network. But pretty much most of our doctors take almost every insurance except for those few.
Our insurance at my school is always interesting because just about 3 or 4 miles west of East Chicago High School is Illinois. So you can almost kind of go to any school you really want to out here. You don't have to really live in that area. You might supposed to be, but you don't really have to be. So sometimes I'll have something happen where I need to get them to an orthopedic, but they'll have Illinois insurance. So they're not going to Indiana orthopedic, they're going to Chicago. It's like, and then a lot of times if a lot of my kids will have some type of Medicaid type of insurance, there's so many different Medicaids, it's crazy. So they might go to the emergency room for an issue and get referred to an orthopedic, and then the orthopedic doesn't take their insurance, or the concussion specialist doesn't take their insurance. So then they go somewhere else and receive less adequate care from a less specialist, more general person, and you're bouncing back and forth. So insurance can be a very big issue for where I'm at.
I'm sure we all deal with that a bit.
Yeah. So we kind of heard everybody's teams in regards to trying to talk to the YPs. just trying to kind of make sure with some information, what would be essential.
Well, Paul
And
didn't
I
know.
kind of want to break it down two things: essential to your network and essential to what you want on the sideline. And the only reason why I say that is because Paul kind of provided that example of the ER physician. I wonder if that may be a little bit different. Like, what do you want on the sidelines for Friday night games versus what do you have that your sports medicine team within your network that you can call and get your athletes seen and expedited, taken care of as quickly as possible.
Well, Paul
I think
is meteorologist.
Yeah, I forgot about that. We do have a meteorologist on our sports medicine team too. So, but I think it really comes down to what we've talked about in the past with what services we are providing and what kind of program are we creating. So it comes down to what does your community need? You know, if you're a small school in the middle of farmland and there's 3 doctors in your town, well, you got to get to know those 3 doctors and the 3 physical therapists that are in the town and the EMS squad, and you work together and provide what you can. You're in the middle of Atlanta, Las Vegas, DC. You got a lot more options. So you got to have to determine what does your program need? What do you want for your athletes? And how do you get it?
Tony, before we got on, you mentioned like you got to make sure also that people on your team are working with the vision that you have for your program.
Exactly.
Yep.
That was something you mentioned before we even started recording, and
Yes.
I've been thinking about that since you said it. Like, well, if you see me daydreaming over here, I'm just sort of rehashing some of our conversations. And like, the more I think about that, yeah, you know what? If the person's not jiving with you, you gotta look elsewhere. You gotta create new relationships and start talking to new people. And I mean, with me, we have urgent cares all over town, so it'd be beneficial for people in a city setting. Hey, walk into the urgent care and introduce yourself and talk to them, just so that you know who the person's going to see when you send them there, when they say they've been, you know.
That, and when you collect in physicals at the beginning of the year, you may have, you know, you're collecting 300 physicals for football season. You got probably 100 different doctors signing those forms. Some of those names kind of sound familiar after a while. Reach out to them if they're willing to do physicals. Maybe they and those athletes are seeing their family care physicians, and you like what they're saying. So when you send them for a concussion, and they're saying, "Hey, see your athletic trainer, do progressive exercise, do those things that we want to do." Reach out to that doctor. Maybe they want to be part of your team. And that's the hard part for that. I've heard a lot of young professionals asking questions about is how do I get a team doctor? How do I get a supervising physician? And you need to interview, like you both said. You need to have your vision, and can you find somebody that works within that vision and has the same goals and education that you have about major topics?
A lot of good nuggets right now, Paul. A lot of good nuggets.
Not my first time at this rodeo.
Hey, I like it. So yeah, for me, I agree. You start off, you got to have a vision. Like, what do you want your program to look like 5, 10 years down the line, 10 to 20 years down the line? What is that vision? Create your mission, right? How are you going to strategically get to that vision? So for me, essential, obviously you want to have an orthopedic surgeon, a team orthopedic surgeon, but I personally prefer to also have a team orthopedic physician who is a non-surgeon to actually be my point person. A lot of times, and again, not to knock surgeons, but their true focus is to identify, does this person need surgery or not? So if they don't need surgery, a lot of times they may not be as keen to provide a comprehensive plan if the case doesn't need surgery. Where your non-orthopedic surgeons, again, they don't provide surgery, so they have a little bit better extensive evaluation process. And then they also are usually a little bit more equipped to provide a more comprehensive return to play plan. Okay.
You're describing a DO.
There you go.
Yeah.
Right. So that's one of the things I would advise. If you can, to me, I think that's essential, is both having a non-orthopedic physician, a non-surgeon orthopedic physician, and also having a team surgeon, okay, from an orthopedic standpoint. I think also your team you should be able to coordinate, especially at the high school level. No, you take that back. At all levels, we should be able to coordinate and function very smoothly with a physical therapist clinic. Okay. Or whether you just have one PT that you work with or you work with the clinic. But I think it's very vital that we have that connection. And within that PT clinic, also have an OT associated within that clinic. I think those are very essential. I think we need to have somebody, whether it be a neurologist, neuropsych physician, okay, or even a neurosurgeon, okay. And if you can have all three, great. But I think you need to have somebody within that realms to be able to oversee your head injuries and also specifically your concussion cases.
Tony, take it with that though. Going back to your PT, OT, hopefully they have vestibular therapy skills.
Agreed. Agreed.
Yeah. See, I was really lucky where the company I was initially hired through, we had a concussion clinic. This is the only thing that doctor saw were concussions all day, every day, all day, every week. And then if it was referred, there was physical therapy, vestibular therapy, and occupational therapy all within the same house that we would refer a lot of things to. And he understood sway balance scores and impact scores and symptoms and how driving at night was affecting people, or how, you know, concussions and work related and cognitive difficulties. If I had to pick one, I'll take that doctor.
Yep. Now, moving beyond orthopedics, going kind of back to what Paul was talking about, and y'all can continue to chime in. I'm just thinking about what I think is essential is from emergency standpoint. Now, some of us, we might not be able to dictate who's coming to our field every day, you know, what EMTs or paramedics is coming to our field every Friday. So minimum, I say, know your company. Who's managing the people who's coming to your field or to your athletic events when they come. You know, make sure that you have that, that you know who they are, that y'all have talked about your emergency action plans, that y'all are on one accord. Okay, whoever your chief medical officer is that may be running the ER clinics and who you're referring to when it's an emergency situation. I know Paul talked about having an ER physician. If you have that ability to have them on the sideline, great. But if you don't, if you still know where you're going to be sending most of your cases 9 times out of 10, you should be able to reach out and call and make sure that there's an understanding. For example, not every county or every state utilizes spine boards. So you need to be in one accord. Like if you still want to utilize spine boards, you need to be reaching out to your chief medical officer who is overseeing your county in regards to what these emergency protocols look like. And you need to be on the same page. That needs to be a part of your circle of care.
And with that, if you're dealing with football or lacrosse, when EMS gets there, are they expecting pads on or pads off? Can they help you remove those pads? If not, are you traveling to the ER to help the physician remove those pads? Yep. There has to be a plan. None of those are, I don't think any of those are a wrong answer, but there has to be a plan and it has to be coordinated.
And there's a lot of ATs in positions where EMS isn't on site. So when you have that medical timeout with the referees and maybe an away AT, you can say, hey, I'm comfortable in taking off equipment, and they might not be comfortable, but then if EMS, you know, they can just show up, and it might be 3 different providers. Where I grew up, it was the city. The city had firefighter paramedics, and they were coming. So you could know those 30, 40, 50 people out here, who knows coming. So they could be, we're going to leave that stuff on, we're going to take it off. And they could also be, hey, you're a medical provider, athletic trainer, I like you, or get out of my scene, this is my area now. So it's like, who knows what you're going to get.
Yeah, that's a whole nother discussion. What goes on once the ambulance arrives on site, because I mean, some people say, hey, I still want to be involved. Some people say, hey, once I transfer care, I've transferred care and it's out of my hands at that point in time. And from a legal standpoint, that's probably more the place we should be. But agree, knowing what to expect when they come on site is vitally important. So you don't have that argument on the field. Like, what do you need to take your equipment off? You don't know what you're doing. Like that's not good customer service at that point in time. Because remember, you got a body on the field with you while you're working on that. So,
and that's why I expressed to YPs, if you have the opportunity, you know, and speaking from my example, we work with our fire department. They provide us paramedics for our games. So we have in-services beginning of the year to kind of talk about our protocols.
There you go.
Metro Atlanta is actually the EMT company that, EMS service system that comes to our games and events of emergency. I've also reached out to their office manager to talk about their protocols to make sure that they understand what we're wanting to do and how they can help us with that. So even though I haven't met everybody from Metro Atlanta, I haven't met all the EMTs or paramedics that are coming on the truck, they know our protocols. To me, they're still a part of my team. And I've also discussed spine board versus non-spine board. So we're all on the same page in regards to how we're going to move forward, my fire department and also our EMS services. So to me, they're still a part of my team. And to me, it's important that if you don't have that, you got to have the understanding of reaching out, calling, communicating, educating one another, and then finally coming to a conclusion where you both agree on how you move forward.
Tony, is there anything else you would add to your mandatory list?
So we talked orthopedic in regards to our physician care, and then also talked about from a physical therapy standpoint. We talked about emergency. For me, honestly, I think you need to have a dental component.
I agree.
I really do think we have, if you can. And for me personally, we have not established that yet here at Walton in regards to having a team physician, somebody who I can call and expedite, especially if it's emergency care versus non, but we don't have that yet. But I think we need to have some type of dental component.
A dermatologist too. That's one.
Yes,
I think you
yes.
absolutely need a dermatologist because there are so many skin conditions that I can tell you what, hey, that ain't right, but we need to make sure we're treating it appropriately. You need to make sure you rule out MRSA on everything. If you think they got an infection, better rule out MRSA before you go any other way and treat it. Like that's stuff that needs to be, because I mean, that's an emergency to me. Like someone that got MRSA, that's a biggie. You can't miss that. So you kind of need that dermatologist on point, and they need to understand, hey, this is athletics, this is how we roll, and there are skin conditions that can be transferred between teams. I mean, I've had skin conditions with every sport. I work a lot of wrestling, so I see it in wrestling. I've had ringworm breakouts in basketball teams, on football teams, on softball teams. Athletes are dirty, man. Hopefully the Rona gets us a little cleaner over everything and we start to get rid of some of that. But dermatologists would absolutely be on my team. Sorry, I didn't mean to interrupt there. But
young impetigo and young herpes gladiatorium look very, very similar. And impetigo, it's a bacteria infection, not necessarily a big deal. You don't want herpes spreading. Herpes is forever. You get that forever. So you want to diagnose that quickly. I agree with you, Mark.
Yeah.
That and an ophthalmologist. Right. Most of us don't know many eyes.
Yeah. I would even add in, I mean, if we're talking ideal, I want a cardiologist if we're talking ideal. Now, I know at the high school level, we're dealing with younger patients. So the relevance of heart conditions is a lot, is a lot lower. I definitely understand that. But at the end of the day, especially here in Atlanta, for example, I'm dealing with a lot of athletes, African-American athletes. Sickle cell is very prevalent here in Atlanta. That's probably why we probably have one of the highest research clinics here in Atlanta in regards to sickle cell. But I think cardiology is important, like especially with mass physicals. When things come up, I would like to have a cardiologist that I can refer to. More importantly, not just to be able to evaluate, but also understand the risk and the demands and the risk of the sports to be able to make a sound and confident decision if an athlete can truly participate at this level of sport or not. I have worked at the collegiate setting multiple times where we have been referred to a cardiologist, but a cardiologist does not have the confidence beyond the evaluation to determine if it's really truly safe for the athlete to return. So I've actually had frustration with parents where a kid is referred to like 4 different cardiologists because nobody was confident. So that I want to really add in is I think it's ideal to have a cardiologist who understands the demands of sports, who is willing and comfortable with making sound decisions. Now, if they're not cleared, they're not cleared. That's fine. But somebody to be comfortable to make that decision. Now, in the event of COVID, I think it's even more
important. I was going to say that.
Yep. Just for the fact that I know our younger kids are thriving a little bit better than the older population, but younger kids are still having complications.
We don't know what's going to happen. This is a work in progress. I mean, the British Journal of Sports Medicine article came out last June, I think, about the potential cardiac risk. there's going to be studies coming out over the next 5-10 years that we're going to need that. And that like, who knows, like if this virus sits in us like herpes does, the gift that keeps on giving, I mean, who knows when it may pop back up or how it may manifest in the future. So that cardiologist with the sickle cell and with the COVID now, that's like a double whammy for having that one on your staff and just making those relationships and making those conversations. And I love how you mentioned make sure they're comfortable with understanding the demands of the sport, because that's our specialty. But we need to make sure that we're getting that information to them and they understand that we're dealing with athletes and not regular sedentary populations.
Yep.
There's a big difference between general population EKG and an athletic EKG, and you need somebody that's comfortable in reading that. Yep. And I would say with all of these, with that list of specialists that we just talked about, they should all be familiar with sports. If they're not, and they just want to hang out on the sidelines, that's not helping you. You need somebody that's sports, like orthopedics, family practice, all those specialties. There's a sports medicine fellowship that they can do and get that extra training. And maybe it's a parent who's a family parent that wants to be part of your team. Ask them to go do that training, and then they can be on the sideline. But to have somebody hanging out just to get in your way doesn't help. The other thing that I would say about all these people is I want somebody that wants to be there. We've had a physician whose son was a teenager playing sports at their high school, and I couldn't get him there to cover a game to save my life. I think he stepped on our campus once in 7 years. And he was a great doctor, great guy. He took all of our kids in his office. I mean, he was a phenomenal surgeon. He just didn't want to be there. It's just not as fun and have that family tie to work together and to be able to communicate the way you really want to.
I agree with that.
Things I would add to my essential list, because this is what I currently have and I don't want to downplay their importance, is a full-time nurse and a full-time strength coach. Those are two extensions of me that I use almost every day of the week that relieve some of the load and some of the responsibilities. It just helps me overall. We know the strength coach brings lots of value. If the kid is functional and playing sports, but they have a little issue, well, you don't need to be with me for 45 minutes for your rehab. You can go to the fitness center, strength coach, get on a program, get big and strong, and they can work you through that, show you how to lift, show you how to move. Same thing with the nurse. If we have concussions and I text, or if I email 6 teachers and I'm like, hey, I'm the athletic trainer, this person has cognitive difficulties and stimuli, like your class might give them some issues. They're going to be like, yeah, I don't know who you are, I don't care. But if that comes from my nurse, they're going to do it, period. So,
one last thing I would say about that long list of practitioners that we have on our team. Some of them you need daily, and some you might need once a year, and some you might need once a month. You need to break down and look at your population. Who do you need on your speed dial versus who do you need a business card for? And keep in touch with all those people, but there are people you need to have quickly. And so when you're creating your list, think about who you need, what you need now, and who do you need next week, next month, and so on.
Thinking about that, how often do you maintain contact with them? If they're a once a year person, are you calling them month? Like how do we maintain the relationship? Because that's like the next portion of this is like, okay, we got a guy or a girl. We got to make sure we're maintaining the relationship so they don't see us as just using them. I mean, it's
right.
What are there things that you guys do with people that you don't talk to on a daily, weekly basis with your docs?
I think for me, you can maintain the relationship actually through business. You bring up a great question, but even though I may not be talking to them on a daily basis, if I'm sending the kid, even if quarterly, they get 1 or 2 athletes on a quarterly basis. They know it's coming from my school. They know it's coming from there. A lot of times we're sending referral notes. So they're communicating through those referral notes. So even though it may not be a personal communication, there's still business communication going. But outside of that, I don't have the best advice. I'm kind of curious to hear what, Paul or Tommy, you all may come back with, but just, following up through email, just what I like to do is say, hey, we just finished up with the fall season. For the most part, I know we didn't have a lot of things, necessarily go your way, but I just want to kind of let you know the outcomes of some of our teams and how things are going and where we're moving forward, and just kind of let you know what we're looking to do within a sports medicine program. Let me know if you have any questions or concerns.
Social media has helped me out. I follow those practitioners, they follow me, so I can send them a birthday wish. And when things pop up on when I'm posting about a team or something like that, I make sure to include and tag them. I try to anyway. And just keeping in touch that way. That's the biggest way that I do it. And then annually try and make sure that you're making good contact and doing other things beyond just saying, hey, I need you to come do a mouthpiece, or hey, I'm sending you a kid for a dental, for a broken tooth. So I use social media quite a bit for that. But when I give them a schedule of all of our events before the season, and we have regional passes that get them into any game in the region, I make sure they get one of those so they can come and watch whenever they want.
Nice. That's a good idea. I always did the Christmas calls and all of that, and birthday calls, things like that, just to sort of keep it more personal, not always business. But I like that's cool that you guys give them the regional pass and you can go check out anything anywhere. That's not a bad gig. We're on 2 minutes here, Tom, too. Just making sure you're paying attention.
Yeah, no, I see it. I don't have anything to add to that segment.
I mean, hopefully everybody, hopefully, like I said, the biggest thing I think we covered, to me, the essentials. I think the biggest challenge is trying to attain all those.
Yeah, and you're gonna, depending on where your area is, what your population is, the essentialness is gonna vary.
Mhm.
Like a lot of my population is minority athletes, so sickle cell, very real thing. But if you're somewhere else where 99.9% of your student population is white, maybe sickle cell is not a big thing. So it varies from where you're at in your population style.
The one thing
Go
I
ahead,
would
Paul.
add for the young professionals that I think is really important is you're the expert for your community. You know what your program needs. Do not be afraid to interview a doctor to find out if they're going to fit the needs of your population. Just because they have an MD behind their name, they're not better than you. They're not more important than you. Interview them and make sure they fit the bill. It's like, I think we talked about interviewing before. There's a fit there, and that fit is so important. And you want that fit from your physician as well.
I'm gonna let it end there. Paul finished strong.
All right. Well, thank you for spending part of your Sunday here, discussing all this fun stuff. I appreciate all of you.
Good seeing you guys.
Yeah, have a great, stay safe out there.
Have a good one.